A third suspected case of monkeypox is under investigation in Sacramento County as confirmed cases around the nation are growing.
Yeah, this is coming after the CDC confirmed the first case of monkeypox in Sacramento County. That was last week. Fox 40's Karma Dickerson is live at the state capitol with what we need to know at this point. Karma.
At this point, there are 3 known monkeypox cases or potential cases in the state of California, and they're all right here in Sacramento County, identified through a method that we've come to become fairly familiar with over the course of the pandemic: contact tracing. The only known monkeypox cases in California are in Sacramento County. Health officials sent samples from a third suspected case to the CDC over the weekend. The first confirmed case was announced May 25th in a person who had recently traveled to Europe. The virus spread through the respiratory system, so you could catch it by being face-to-face with an infected person for a prolonged period of time. It can spread through bodily fluids, skin lesions, contaminated fabric like clothing or bedding, and through sexual activity. Contact tracing led officials to that second confirmed positive case announced Friday, and now a third person in that network is believed to be infected.
The question that I think has to be addressed is how widespread is it already? And if it is not particularly widespread, then it seems like you can put a little bit of a rope around it.
Dr. Stuart Cohen, infectious disease specialist with UC Davis, raised that question with us last week when he was reflecting on the first confirmed case. The answer? Still unclear. The CDC reports 15 cases scattered around the country, including confirmed monkeypox cases as well as orthopox virus cases. That's the family of viruses that includes monkeypox. Overall, cases nationwide and locally have been mild. But while maintaining risk to the general public is low, the CDC has a travel alert, urging people to be cautious in North America, Europe, and Australia, where the virus has recently been reported.
It may or may not become a big thing. I think people just have to be aware and be smart.
That includes knowing the signs, which are basically looking and feeling sick.
If you have a skin rash that you don't understand, or if you have fever or other symptoms, you need to be evaluated. And then, yeah, I think condoms are a good thing right now.